This film explains how a child or young person can get the support they need through an education, health and care plan. In September 2014, statements of special educational needs and learning difficulties assessments will be replaced by an education, health and care plan, also known as an EHC plan. An EHC plan is for children and young people with long-term special educational needs and disabilities that require a high level of support from different services. It allows children and young people with special educational needs and disabilities to get the most out of their lives. The EHC plan covers education, health and care services for young people up to the age of 25 if they stay in education and training. Not all children and young people with special educational needs will need an EHC plan because they can access all the help and support locally in school, through health services, through groups, organisations and charities. These services are available through the local offer. We describe the journey for an EHC plan as an education, health and care plan pathway. We use a tube map model to explain each stage of the pathway for children, young people and their families. Not all children and young people will progress through to every stage of the pathway. Step 1. SEND support. Step 1 introduces families to the support available in Waltham Forest. Most children and young people with special educational needs and disabilities who live in Waltham Forest will remain at this step, as their educational needs can be met within the local offer of support available in the community, in schools, early years settings or colleges and through health services. Waltham Forest has a range of services available to meet the needs of children and young people who have SEN and disabilities. The local offer covers support services from ages 0 to 25 across education, health and care. It can be easily accessed on a website. If a child or young person's needs can be met through the support already available, they will not progress beyond Step 1. Step 2. My referral. When a professional working with a child or their family believes that their child's needs are significant, long-term, and require support that is not available through the services in the local offer of support, then it's time to move on to Step 2. In most cases, professionals working with the family make the referral on the family's behalf, for example, the early years setting or the school. They will call a person-centred meeting inviting the family and all the important people who work with the child. An officer from the local authority will attend the meeting and everyone will look at the support provided, the service available in the local offer, and whether the child or young person is eligible for an EHC assessment. Not all families will progress beyond this stage. If it is decided not to start an EHC assessment, the family will be offered alternative support. This may be additional help to what is already provided. Step 3. My story. If it is agreed to start an EHC assessment, we move to Step 3 of the pathway. This is where we gather information about the child or young person and their family's aspirations and hopes for the future. The child, young person and family will be asked to complete an All About Me report. They will be supported in doing this. We look at what's working well and what's not working well in school and outside of school to see what we can do to help or make things improve. We ask professionals working with the child or young person to make an assessment report, giving advice on how they think they can be helped across education, health and social care. Everyone who is involved in the assessment has 6 weeks to make their reports. Step 4. My plan. Once all the reports are received, we will arrange a meeting with the family to look at whether to make an EHC plan. If we decide to make a plan, we will do this together with the family. This is called co-production. At the meeting, we will look at all the information gathered at Step 3 and use this to develop the EHC plan. The EHC plan covers the child or young person's education, health and social care needs and the support they need to meet their goals. We will discuss which education setting the family would like to be named in the EHC plan. Depending on the age of the child or young person, this could be an early years setting, a school or a college. We will look at whether the child, young person or their family would like to have a personal budget to help with their support. Step 5. My budget. All children and young people with an EHC plan can have a personal budget, but not all families will want to request one. The EHC assessment will look at what support may be available to the child or young person through a personal budget. A personal budget is an amount of money that can provide support for the child or young person's social care needs outside of school, their educational needs provided by the school, or their health needs. Some families may want to ask for some of the money to be provided directly to them so they can take control of their support. This is called a direct payment. Other families may want to ask an organisation to help plan their support for them. Waltham Forest allows some services to be provided as a direct payment. This will be explained to the family. Step 6. My review. Every child or young person with an EHC plan will have their plan reviewed at least once a year. The review will usually take place at the nursery, school or college where the child or young person attends. In Waltham Forest, we hold person-centred reviews which involve the child or young person and their family so that they are at the centre of the review. We celebrate the child and their achievements. We look at what is important to them, what is working for them and what is not working. We will look at the progress that the child has made towards their goals and whether we need to make any changes to the EHC plan or the support in the plan. We hope that this film has helped you understand the education, health and care pathway. If you would like further information, you can contact the SEN team and we will be happy to help answer any questions you may have.